at the sink, in line at the store, or maybe just talking with somebody, and then bam, the pain shoots down your leg again. Sciatica can come and go, but when it happens just from standing, it's usually not a coincidence. Something deeper is going on in the spine or in the hip, loading pressure onto that nerve. Let's figure out what it is and how to fix it. When standing, your body is supposed to equally distribute the stress between your spine, your pelvis, and your hips. But too often we stand in certain positions that irritate the nerve. When you stand in a relaxed state and your hips tend to shift forward, that puts pressure going back on the nerve and the disc starts to irritate it. It's kind of like squishing a jelly donut. However, if you've been standing for a while, getting fatigued in the hips or glutes, and you find yourself bowing your feet out more when you stand, it might be coming from the piriformis, irritating the nerve from below. Two different causations, big difference in the fix. I want to have wall support, and I'm going to stand tall, shifting the weight to the back of my heels just a little bit, arching my back and chest. If this causes pain to shoot down into the spine, down the leg, or causes a heavy feeling, it's more likely to be related to disc. Next, I'm going to shift onto my back leg of the painful side, kind of like sticking your bum out or showing someone your pocket. And then I'm going to rotate back towards that direction without moving my legs. If you feel a deep ache, tenderness, or sensations down the leg from this, you may be irritating the piriformis muscle. And if both bother you, that's okay. We got a fix for both. Now, if you're in a jam for time, did you happen to check out our previous video we did on sciatica exercises while standing? Boy, sciatica sucks. Yes, it does. Check it out before or after these quick fixes coming up next. For disc pain, we need to open up space. And spinal flexion does that, but leaning forward with gravity's pressure actually aggravates the disc. So what we need is a counter or something that you can place your hands on for support, and I'm going to flex forward onto the counter while tucking my pelvis underneath. I can even bring my legs a little closer and gently flex and hang, tucking and opening up, coming back up to relax, and repeating again, flexing down, sinking into the position, almost like you're sitting on the throne, and let gentle pressure relax the back muscles. An additional tip is to remember that when you flex forward, there is pressure on the disc from gravity. So when I'm brushing my teeth, when I'm working, it is okay to lean, support your body with at least one hand. The core muscles don't work very well. So it even helps to tighten the tummy muscles. And this is crude, but I tell my patients all the time, imagine you're about to get a punch in the tummy and you squeeze. That helps keep your core engaged. So when you transition or bend, tighten the tummy, and that will help your brain remember not to throw your back out. If the piriformis starts to spasm, we got to calm that hip spiral down. What you're going to do, while standing tall, internally rotate the leg slightly of the affected side. Then you're going to gently squeeze the glute and hold for 3 to 5 seconds. You can also lean slightly while doing so, but not past the point of pain. And then relax and come back. Squeeze and hold 3 to 5 seconds at a time. After 3 to 5 repetitions, shake off the leg. It should calm that spasm down. Now you can also do this against the wall. I can go against the wall and gently press into the wall, getting an isometric contraction, and then letting the body rest. Squeeze and hold 3 to 5 seconds and rest. Now say you have both. What do? We combine the two. First, we're going to take out the rotation and internally rotate the affected side. I'm going to stand tall and take the pelvic tilt out of the equation. Then I'm going to raise my knee on an elevated surface. It could be a stool or a box underneath your desk. Then I'm going to lean over that counter space to traction and flex my pelvis down, helping the pressure on the disc. Then I'm going to slightly lean away from the affected side with my chest, try to sit up a little bit and feel the stretch in both my spine and the piriformis gently. Hold for 3 to 5 seconds. Always reset, sitting up straight. You can take the leg off and try again. Leg up, pelvic tilt out of the equation, flexing forward, slight lean away, and stretch. Just make sure not to take the computer with you. A few habits can make a huge difference. Next time at the counter, alternate one foot ahead of the other every few moments, taking the pressure off your back. And whether it's at the desk or checkout line, shift weight every minute or two, side to side, front to back. So if standing triggered your sciatica, try your quick check, see which fix is right for you, and put down in the comment below which is the best fix. These are the same drills I do with my patients every day to help them get better walking and moving. And if sitting or walking do cause you a problem, check out the links below. We have all the routines right there ready for you. I'm Dr. Ben. Remember, don't stop moving.